Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Zoe here with us today, and Zoe's been having a lot of... I do it occasionally to break up fibrotic scar tissue if I see that in there, but she doesn't really have that. Perfect. There we go, perfect. Good. There we go. Okay, drop this right in my hands here. Okay, and one more here. Perfect, good job. Oh, yeah. Okay. Yeah. Boy, oh boy. And swimming is a great exercise for people who are having chiropractic care, if they do it properly. Oh yeah. Okay, that's all. Yep, there we go. One more. Gluteus medius maximus first, and I know this is really tender yesterday, and probably still is. I'm not pushing as deep as I was yesterday. There we go. That's getting down into the piriformis muscle, which goes from the sacrum right over to the actual hip joint. So it's in play a lot when people have sacroiliac problems. There we go. Okay, I'll be nice now. Paraspinal muscles, muscles down the pelvis, in the legs, and everywhere. The only place I don't recommend to use it is on their head. Okay. That's it right there, perfect. And this is a Palmer diversified adjustment to the cervical spine, and we just moved occiput C1 and C2 bilaterally, and that felt great. Now just nice deep breath through your nose, keep your teeth together and let it all out and relax. There you go. Perfect. There we are. Excellent. There.
Wait a minute.
Put your face way down in there. There you go.
Yeah. Wait a minute.
Put your face way down in there. There you go.
Yeah. Ooh, wait a minute.
Hang on. Breathe. Put your face in there. Okay. Oh, yeah. Yes, sir. I don't know if you could hear those over there with the wind. She's moving great. Prosthesis on. Is that a little more tender on the right? Real tender right in the center, though, huh? Where I'm touching them. See, that spasm goes all the way up into the thoracolumbar region. You feel that on both sides?
Yes, that's tight.
Yep. Really bad right there. Touches the spine and feels exactly where the vertebra are misaligned. That's out right there. That's a rib. You ever feel pain around your ribs?
Yes.
Yep. Yeah, let's see.
Right,
Right there's out, and right there too. Ooh, that one's bad right there on the left. And is this where your headaches usually come from, right there?
Yes.
Yep. Right there on C2 on the right. You get sinus problems as well?
I've been having them the past week.
Yep. Boy, T5, 6, and 7 are all interior.
That right there.
Uh-huh. You get big time spasm here. You ready to feel better?
Mm-hmm.
Okay, now I want you just to breathe normally and exhale for me. Okay. Just let it all relax. That's what I'm looking for. Okay. That's it. Oh boy, got some excellent movement up there. That was better. Okay. Perfect, good job. Yes, sir. Okay. And just let me kind of decompress you. There we go, good.
Breathe. One more time. Very nice. And a little stiff right there. Very good. 3 or 4 over there. Very good. Just work our way up his thoracics. All sorts of little crinkles. All right. Dr. Johnson has these back muscles that are very sensitive in a chronic way. I'm going to put an elbow contact and do a little pressure work on that for him. You all right, sir?
Oh, yeah.
Just going to work my way down. A couple little contacts here. So chiropractic work is very physical. For the patients that have had Dr. Johnson work on them, they appreciate what this is. Dr. Johnson similarly works his own body over, adjusting everybody, and he needs a little help. Pressure's okay?
Yeah, it just feels like my real head neck here. Oh.
Got some sensitive ones. Okay. Work down the other side.
Videos are for educational purposes only, on to show what we do as licensed professionals, chiropractors, to help people with spinal problems and subluxations and pain, herniated disc and like. There we go. That's it, perfect. And you can tell she adjusted really well. That's a Palmer diversified rotary cervical brake. Keep his teeth together. There we go. Boy, perfect. Boy, that's moved a lot better this afternoon too. Good. Right along, see, he's starting to feel it right there. Right along the edge of the spine. All the way up.
Spinous erectus.
Yeah, these are the erector spinae muscles, and they go all the way from the occiput down to the sacrum. Now I'm working up into his traps even. Suction bottles. Isn't that what they're using? Those little Chinese suction bottles?
Yeah, that's part of what they do, plus acupuncture.
And acupuncture in there as well. A really good oblique lateral stretch right from his right SI joint all the way up into his thoracic spine on the right side. As I'm contacting his left SI joint, I'm pushing it down and out, and then his upper thoracics, I'm pushing those up and out. So we're getting a oblique superior stretch in all these paraspinal muscles. And I felt quite a bit of movement this morning in his ribs when we were doing this, more so than any other time. I'm using this Kleenex so my hands don't slide on him. There we go. And you can see I'm putting my entire body weight into this, so. Okay, good.
Oh, it feels so good. That is awesome. Oh.
There. You can see where I get my workout every day. Yeah. But Renee and I have really enjoyed Bo and his wife being here all this week, and they've just been a real pleasure to work with. And a lot of fun during our visits. And